Hey there, thanks for stopping by and welcome back to my channel. If you're here for the first time, I'm Ms. Devi Sundar, founder and director of Tele-therapies. In my last video, I've tackled some misconceptions of depression diagnosis, and in this video, I'm going to talk about how depression is actually diagnosed. First, let me guide you with some research evidence that supports the diagnosis of depression. Research studies have consistently shown that depression is a highly prevalent and debilitating condition. According to World Health Organization, depression affects more than 264 million people worldwide, making it a leading cause of disability. Diagnosis of depression typically begins with an assessment by a healthcare professional with a mental health background. This may involve discussing symptoms, medical history, and any family history of mental health condition. The diagnosis of depression is based on a specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorder, DSM-5. These criteria include experiencing symptoms such as persistent sadness, loss of interest or pleasure in activities, changes in appetite or weight, sleep disturbances, headache, feelings of worthlessness or guilt, and difficulty concentrating. To receive a diagnosis of depression, symptoms must persist for at least 2 weeks and significantly interfere with their daily functioning. The severity of the symptoms can vary from mild to severe based on the frequency and intensity of symptoms, duration of depression, impact on the daily life, and in severe cases, some symptoms of psychosis might persist. Numerous studies have demonstrated the reliability and the validity of the diagnostic criteria outlined in the DSM-5 in identifying depression. These criteria have been rigorously tested and refined through clinical research to ensure the accuracy in diagnosis. So depression can gradually develop and it makes it more challenging to identify in a practical life. Sometimes your friends or family members might notice first before you could actually recognize that you're depressed. And it's very crucial that differentiation should be made between a grief and depression. Everyone who goes through personal loss might have symptoms of depression, which can be resolved over the period and they can be recovered. In some cases, bereavement can go into a depression. So it's very essential to be having a watchful on the symptoms. Neuroimaging studies have provided valuable insights into the neurobiological basis of depression, highlighting abnormalities in brain structure and functions associated with the condition. This research has contributed to our understanding of underlying mechanism of depression and development of targeted treatments. Clinical trials evaluating the efficacy of various treatment approaches for depression, including psychotherapy, antidepressant medication, and brain stimulation techniques, have consistently demonstrated the effectiveness in reducing the symptoms and improving the quality of life for individuals with depression. Once diagnosed, there are various treatment options available, including therapy, medication, lifestyle changes, and support from loved ones, which is very important. The most effective approach often involves a combination of these strategies tailored to individual needs. Understanding the true diagnosis of depression is key for seeking the appropriate help at the right time. If you or someone you know is experiencing symptoms of depression, don't hesitate to reach out to a healthcare professional. Remember, help is available and recovery is possible. There you have it all, how to do a true diagnosis of depression and by seeking a right healthcare professional to diagnose and also seeking the right treatment at the right time. As usual, stay healthy, stay curious. Signing off, Devi Sundar.